I will be presenting on alcohol access and communities, exploring the link between access, social, and health outcomes. Maybe. Okay. So to give you a little bit of a roadmap for my presentation today, I'll first provide some background on the connection between alcohol outlets and violent crime and provide kind of the policy context for our study. I'll go through some methods that will help you better understand what it is exactly we're looking at. Then we'll get into some results for our study, including some of the results from our many sensitivity analyses, and get into some of the policy implications of our work. Sorry. We're coordinating two different things here, so give me a second to get used to it, get my bearings. All right, so why are we interested in the connection between alcohol and violence? Well, in the US, there are 67 homicides per day. And of these 67 homicides, 19 of them, or about 28%, are assumed to be caused by alcohol. And alcohol is often left out of these conversations, despite the fact that alcohol is the #1 drug used by homicide offenders, with 39% of offenders either using alcohol alone or alcohol and cocaine. Additionally, an estimated 48% of homicide offenders had a positive BAC, or blood alcohol content, meaning that any alcohol was in their system, and 37% were considered intoxicated with a BAC of 0.08 or higher. Thank you for that emphasis. So what makes alcohol particularly salient in the context of violent crime is that it not only increases the likelihood that someone will be a perpetrator of violence, but it also increases someone's likelihood of being a victim of violence. In fact, it's been found that almost 40% of homicide victims had a positive BAC at the time of death. Further, of those with a positive BAC, about 2/3 had a BAC of at least 0.08, indicating that they were legally intoxicated at time of death. Now, because we see this consistent link between alcohol and violent crime, it should hopefully not be surprising that alcohol outlets are very well-established violent crime attractors. Systematic reviews have consistently established a link between alcohol outlets and violent crime, with the levels of violent crime essentially paralleling the levels of alcohol outlets in neighborhoods. And to further complicate these relationships, alcohol outlets really tend to cluster. I don't know how well that color contrast is there. Alcohol outlets really tend to cluster in historically disadvantaged and disinvested neighborhoods that consist primarily of low income and other marginalized individuals. And this means that we sort of force violent crime in these areas even more so. And this graphic, which I borrowed from a paper done by my mentor, Dr. Pamela Trangenstein, shows historic homeowner loan corporation, or HOLC grades in Baltimore, with outlet clusters for both on and off-premise outlets overlaid on top. And if you are unfamiliar with these HOLC grades, the practice began in 1933 with the creation of the Homeowners Loan Corporation, and it was meant to provide access to homeownership and means to social financial mobility, but I don't think anyone will be surprised when I tell you it wasn't distributed equitably among individuals. So the term redlining, which maybe you've heard before, refers to the red marks that I'm not sure if you can actually see on there, that indicated neighborhoods that were comprised of predominantly, or at least a significant portion, of Black or African American families. And the demarcation resulted in these discriminatory practices that made housing resources even less accessible to Black neighborhoods. And while the practice of historic redlining was overturned by the Civil Rights Act of 1964 and the Fair Housing Act of 1968, the enduring effects of economic exclusion, neighborhood disinvestment, and this codified limitation on access to resources can't be totally undone by simply making housing discrimination illegal. So it should hopefully come as no surprise that historic redlining is still associated with a wide variety of health behaviors and outcomes to this day, including where alcohol outlets tend to be located, especially those that sell for off-premise consumption, like liquor stores. So to break this link between alcohol outlets and violent crime, especially in these disadvantaged neighborhoods, we have a few different policy options, and all have their respective benefits and their respective disadvantages as well. So the first is to actually limit alcohol outlet density through licensing or zoning regulations that reduce the number of physical outlets that can operate in a locality. And because increased access to these outlets sort of drives down prices in line with the availability theory, it makes alcohol not only physically more accessible, but financially more accessible. And this really enables both binge and underage drinking and subsequent crime. So reducing these outlets can be a very, very vital strategy in reducing the alcohol outlet violent crime link. However, because there is a good amount of pushback from local business owners and even patrons of the neighborhood sometimes, other strategies that we can look at include things like increasing monitoring and compliance checks that limit sales to intoxicated patrons, because violence does tend to increase as BAC increases. We can also restrict hours and or days of sale, and that's really where our study focuses. So in a widely cited 2010 systematic review, authors found that while there was sufficient evidence to conclude that increasing hours of sale by 2 or more hours increased alcohol-related harms, there were two kind of major gaps that were highlighted by the authors. One was that there were absolutely no studies that looked within the US, and the other was that no studies explicitly examined policies that restricted hours of sale by 2 or more hours. They kind of extrapolated that because we were seeing that increasing hours of sale was associated with increased harms, that the inverse was probably true as well. But really, to make research more easily accessible for politicians and advocates, we really have to be explicit here. We don't want to make them do any extra work to try to figure out what these associations would be. So we tried to address this gap, and I will point out that this systematic review was published 14 years ago, and until our study there had still been no studies that answered this call. So there was a huge gap still. So there are two main reasons why limiting late night hours of sale is likely an effective strategy in kind of breaking that link between alcohol outlets and violence. So the first is that as outlets stay open later, it gives patrons an opportunity to drink more and reach those higher intoxication levels. And I think by now, I've repeated it a few times, that you're all aware that higher intoxication levels are associated with these higher levels of not only perpetrating violence, but being a victim of violence. The second is that there are actually fewer bystanders or potential guardians that can prevent violence on the street. And we can see the effectiveness of this strategy in more international contexts. Specifically in Brazil, closing bars at 11 p.m. rather than having 24 hours of sale led to 9 fewer homicides per month from 1999 to 2005. Similarly, an evaluation from a Copenhagen COVID-19 policy that limited closing hours from 5 a.m. to midnight concluded that change in hours was associated with 28% fewer violent crimes per square kilometer. However, these evaluations studied crime kind of throughout the day, despite late night crimes really being the most likely to be alcohol related and not so much daytime crimes. And while this provides some evidence that this could work domestically, we are really limited in our ability to firmly make this assertion because there had been no US studies that looked at it explicitly. until now. We were finally given the opportunity to examine this when Senate Bill 571, or SB 571, was passed on March 15th, 2020. And this bill was proposed by Senator Cory McCray in Maryland, and the purpose of this bill was really to reduce violent crime in one high-priority neighborhood where there was an atypically high number of violent crimes, particularly homicides and assaults. And this bill went into effect on July 1st of 2020 and effectively reduced hours of operation for bar taverns in the Bill catchment area. And these bar taverns, I don't think they're unique to Baltimore, but they are very popular in Baltimore. They allow for both on and off-premise consumption. But it reduced the hours of operation by 7 hours per day. So they went from being able to sell from 6 a.m. to 2 a.m. to 9 a.m. to 10 p.m. And so this also really gets us to the limiting hours by more than 2 hours, because just cutting back an hour or two might not be giving that impact that we really want to see. So our actual study aim was to determine whether late night violent crime in the immediate vicinity of alcohol outlets, specifically those bars, taverns, in the treatment neighborhood fell relative to control neighborhoods after SB 571 went into effect. And I will repeat this throughout, but immediate vicinity we defined as within 800 feet of the outlet. So with this study, we not only wanted to examine whether violent crime decreased after SB 571 took effect in the treatment or bill catchment area, which is that black box right there. We also wanted to determine whether this effect was isolated to the treatment area or if crime was just decreasing all over Baltimore, and that's what we were seeing. So our treatment area, as you can see, didn't really conform to typical administrative boundaries that we would use, like census tracts or census block groups. But we did notice that the treatment area was approximately the same geographic size as a community statistical area, or CSA, which is unique to Baltimore, and they're meant to approximate neighborhoods. And to choose our control areas, we ranked all of the CSAs in Baltimore in terms of similarity to our treatment area based on 3 domains. So we looked at baseline alcohol outlet density, and this was all alcohol outlets, not just those bar taverns. We looked at the baseline total violent crime rate, and then we looked at neighborhood disadvantage. And our top 5 most similar CSAs to our catchment area or treatment area, 2 of them actually contained areas that had bills implemented during our study period, which was between May 2018 and December 2022. So we had to exclude those because we were concerned about potential contamination with those areas also experiencing bills. So our final control areas were Midway Coldstream, Sandtown Winchester, and Greater Charles Village, if you're familiar with the Baltimore area. I was not. And this table shows our primary outcome of all violent crime as well as our covariates in our treatment compared to our control areas. So you can see that our areas were pretty similar in terms of all violent crimes within 800 feet of these bar taverns, neighborhood disadvantage, as well as overall alcohol outlet density and number of convenience stores. However, our treatment area was comprised of significantly more Black residents. So we had 95.5% in the treatment area compared to 55.6% in the control areas. And following, or I guess conversely, as you would expect, we also saw that there were fewer white residents in our treatment area compared to our control area. The population was also a little bit smaller in our treatment area compared to our control areas. So this was probably a result of not using the most similar CSAs, but again, we were concerned about that potential contamination effect from the other areas that had bills. So we did adjust for all of these in all of our models anyway, just in case. So I promise that I won't make us go too into the weeds too much with the data structure of this, because it can get confusing. But I do want to provide a visualization of how the data all relate to one another. So to start, we have our bars, taverns in both the treatment and control areas. And these are all nested within census blocks, and this is where alcohol outlet density was measured. So these census blocks were then nested within census block groups, and this is the smallest geographical unit that we can get sociodemographic information like median income, neighborhood disadvantage, and racial composition. And these census block groups were then nested within our community statistical areas, or CSAs, and this is really where we measured the policy of whether it was an intervention or treatment area versus a control area. Okay, so in terms of outcomes, our primary outcome was all violent crime, and we used the FBI definition of victim-based violent crime, including homicide, robbery, aggravated and common assault, and forcible rape. And because homicides and assaults were a primary concern for the bill, and it was really a driving force behind the bill, we also looked at these separately as secondary outcomes. And these data were violent crime incident data, which is important, obtained through Open Baltimore, which is provided by the Baltimore Police Department. And because we were only interested in violent crimes that were most likely to be impacted by this bill, we had a few inclusion criteria for our different violent crimes. First, we had that we only included violent crimes that occurred between 8 p.m. and 4 a.m., which was our late night definition. And we only looked at crime that occurred within 800 feet of bar taverns in both the treatment and control areas, again, because we were trying to look at really the violent crimes that would be most impacted by this bill. So for the study, we did use an interrupted time series analyses, and really we were looking at two different estimates here. The first was the level change post-implementation, and this is the immediate change that was seen right after the implementation of the bill. So what was happening in the areas that first month of implementation. The second was the slope change post-implementation, which is the change per year or the sustained change after that first month. And you don't have to know this. I promise I won't quiz you on it or anything. But if you want to nerd out about statistics with me, I am an epidemiologist by training. So we did have our interrupted time series used Poisson regression with an overdispersion adjustment and log transformed land area and square miles as an offset. And this is just essentially saying that our results can be interpreted as the percent change per square mile is what we're looking at for the violent crime rates. And we really had three main models. The first was a base model that was completely unadjusted, just a crude model. The second was an adjusted model controlling for our covariates. So those, to remind you, were the neighborhood disadvantage, alcohol outlet density, racial composition, and number of convenience stores. We also thought it was very important to adjust for seasonality because we know that violent crimes peak during hotter or summer months, so we adjusted for that as well in our adjusted model 1. And our adjusted model 2 included all of the covariates from adjusted model 1, plus an adjustment for census block level fixed effects to adjust for unmeasured location-specific factors that maybe we didn't capture through our selection process. And for the purpose of time, I'll only be going through the results of our adjusted model 1, which was what we consider to be our main model. So now to get into some results, I know that's what you're all here for. So I'll go through the results for our primary outcome first, which was all violent crimes. And as a reminder, that included homicides, aggravated and common assaults, robberies, and forcible rape. And if this figure is not immediately intuitive, please do not panic. It took me a while to get comfortable with these also. But to orient you a little bit, on the x-axis, we have time in months. And on the y-axis, we have the total number of monthly crimes per square mile. So this vertical dotted line right here shows when the policy was implemented. To remind you, that was July 1st, 2020. And this is known as our interruption point. So that's why it's called an interrupted time series. And this figure shows the trends of both before and after the policy was implemented in monthly violent crimes in the treatment area, which is shown by the blue lines, and the control areas, which is shown by the red line. And this point right here shows us what happened immediately after the policy was implemented during the month of July 2020. And we did find that compared to the control areas, crime immediately decreased by 14% in the month after SB 571 implementation in the treatment area. Oops, sorry. All right. So if we look at the change over time, or the slope change after implementation, we found that compared to the control areas, violent crime decreased by 29% more per year in the treatment area compared to the control areas again after SB 571 was implemented. So stated another way, we found that relative to the control areas, SB 571 reduced all late-night violent crimes in the immediate vicinity of impacted bar taverns by 14% in the first month, and then 29% per year after that first month. And to put this in more real terms, this translates to an estimated 113 fewer violent crimes and about $12.5 million in tangible costs saved in just the first year after implementation. Now, because SB 571 was particularly interested in reducing homicides and assaults, as I've mentioned, we did look at that in the catchment or treatment area versus control areas as well. And I won't make you look at another interrupted time series graph for the entire presentation, so we'll display them like this. So instead we have the immediate percent decrease in late night violent crimes in the month after SB 571 implementation on the left side, and on the right side we have that sustained change over time. And I've included the percents for our secondary outcomes of homicide and assault, as well as the results from our primary outcome, just so you can see the comparison. But for homicides and assaults, we did not find a significant decrease in the first month after implementation. However, I will make a note here that they both trended downward. They were nearly significant. The p-values were less than 0.1. If you're a stickler for p-values, they were not technically significant, but they were showing decreases in homicides and assaults. And when we look over time, we see that homicides decreased by nearly 50% per year after implementation, and assaults were reduced by 31% per year after that first month of implementation. So you may have some questions about these results. For example, you may be wondering whether crimes just moved further away from these outlets after we were looking within just 800 feet. And it's a great question. And in fact, it was one that came up for us almost immediately after we saw our results. So to address this question, we looked at spatial displacement of crimes. So we looked at crimes within 800 to 1,600 feet with what's called a donut analysis. So essentially, we look at all violent crimes minus those that occurred in the 800 feet boundary that we were already looking at. And we found that there was no evidence that crimes were increasing further away from the outlets. So it wasn't just criminals deciding to move further away from the outlets. It was actually a significant decrease in immediate crime even further out from these outlets. So we see that there might be some crossover benefit even further out from where we were actually looking. So once we determined that this bill did not push crime further away or spatially displace it, another question came up about whether our violent crimes were happening earlier in the day instead of just that 8 p.m. to 4 a.m. time period. So we looked at that too. And this figure shows the results from our sensitivity analyses that examine changes in daytime violent crime. So these are violent crimes that occurred between noon and 8 p.m. instead of 8 p.m. to 4 a.m. during our study period. And while we found that all violent crimes did decrease by about 21% in the treatment areas compared to the control areas, and assaults decreased by about 32% per year after SB 571 implementation, most decreases were not statistically significant, which we were kind of expecting. We didn't really expect this to have much impact on daytime violent crimes. Importantly, though, the main takeaway is that we did not find any evidence of significant increases in daytime violent crime after SB 571. So this means that violent crime was not just displaced in time or space, rather the violent crime was actually reduced across the board. So our last sensitivity analysis included all 26 outlets that were in the treatment area. So we were focused mostly on those 13 impacted bar taverns, but there were also 11 liquor stores and 2 taverns in this area. And here we're sort of operating under the assumption that even outlets that aren't directly impacted by the bill would experience some indirect effects after this bill was implemented, especially from patrons going to the unaffected outlets after the closed early outlets closed. So what we did find was that homicides decreased by about 51% immediately after implementation of SB 571 when we looked at all 26 outlets, and continued to decrease by 40% after that first month. Additionally, all violent crimes decreased by about 23% per year, as well as assaults. And again, this really emphasizes this sort of carryover benefits to the bill. It wasn't just the impacted bars, taverns that were experiencing fewer crimes, it was all of the alcohol outlets in the area. So there are 2 primary limitations that should be considered for this study. The first is that we only evaluated a policy change in one Baltimore neighborhood. That does limit the generalizability of our findings to other communities potentially. However, until we get more policies to look at, we're sort of limited by what we have. Another limitation was that we don't have information about whether the violent crimes were actually alcohol related. We only examined late night violent crimes in the immediate vicinity of these impacted bar taverns under the assumption that they would be most likely to be impacted by the bill, but we don't have any certainty that they were because of the alcohol outlets or because the perpetrator was drunk. So despite these limitations, there is plenty we can take away from this study. First and foremost, this was the first U.S. study to examine the impact of reducing hours of sale by more than 2 hours of violent crime. I repeated that again and again at the beginning. And to emphasize again, this is so important because studies generally look at, these increased hours of sale on violent crime, essentially stating that because longer hours are associated with more alcohol-related harms, the opposite might be true. But really, again, we want to actually demonstrate the association between reduction in violent crime so that we don't have any push or have limited pushback from politicians and advocates that there's no evidence that it would work. Second, we found that reducing hours of sale for alcohol outlets can significantly and substantially reduce violent crime, both immediately and over time. And we found that SB 571 decreased violent crime around impacted bars, taverns by 14% the first month, and then 29% per year afterward, to remind you. And again, this is 113 fewer violent crimes and over $12 million saved in just the first year. And so this is a huge development because it's not overly common that we have a policy that gives us this much bang for our bucks so quickly. So this is a very good strategy. I'm going to push it a lot. And we also conducted numerous sensitivity. What? I can. We also conducted numerous sensitivity analyses, and these results were consistent. It didn't really matter how we looked at it. We were consistently seeing that there were reductions in violent crime around these impacted bars, taverns, compared to other areas in Baltimore. And because of these results, we found that reducing late night hours of sale can be an extremely effective tool in addressing problem drinking and related crimes around these outlets. Usually there's a push for regulating alcohol outlet density and limiting outlets altogether, but these findings do emphasize that we don't necessarily need to take such drastic measures, that may frustrate the business owners and the patrons. We can sort of compromise and still see this slew of benefits. Finally, we do want to emphasize again and again that this study can and should be replicated in other cities, but that means that we have to actually get bills passed, which is a slight a slight burden. Yeah. Oh. Sorry, I have it on here. That is totally fine. Feel free. All right, so moving forward, if we can get these bills passed, I think there are also huge equity implications from these findings. You know, overall, we saw that in the pre-intervention period, 50% of violent crime victims in the treatment area were Black, and about 70% of aggravated assault victims were Black. So the really shocking part here is that we saw that there were 93%-ish of homicide and shooting victims were Black in the pre-intervention period in our treatment area. So this means that there's a potential that Black individuals, and especially young Black men, may have particularly benefited from this intervention, and burden may have been reduced in an already very disproportionately burdened population. It is important to note that this solution is more equity focused kind of in and of itself by design. You know, usually we rely on criminal deterrence and policing to control violent crime in these types of areas, but this can be a link to racial disparities and injustices and kind of exacerbate those. So rather than relying on those criminal deterrents, we can actually make the environment safer for everyone, not just these young Black men that might be most impacted by it. And I will go to my key takeaways so that if you've heard nothing I said up to this point, you only need to know these three things. So first is that these results were consistent. So we ran these models and we looked at them about as many ways as we possibly could. And no matter how we looked at it, the results were telling the same story. You know, limiting hours of sale for these bar taverns, again, significantly and substantially reduced the violent crime by over 20% and oftentimes a lot more. Additionally, and perhaps most importantly, limiting hours of sale is an incredibly simple solution, and it had immediate results. So we saw results in that first month after implementation. We didn't have to wait years and years down the line to see the benefit. It was immediate. And this is, you know, very important because a lot of times these alcohol policies that we implement, we have to wait a while for them to get pushed through, or they're complicated, or there are ways to have some loopholes that it doesn't really matter for, like zoning regulations. So this is important. And finally, I want to emphasize again how practical this solution really is. And by that I mean it strikes a really necessary balance between taking action to improve public health while also taking into account the interests of those business owners and the neighborhood residents. You know, once we get that pushback, it's very hard to get these policies in place. So trying to frame it more as a compromise between public health and safety and then business owners' interests is a very easy way to get things pushed through, or easier. Let me not go crazy with it. And to further emphasize the practicality, as an illustrative example, there were 3 bar taverns that were actually cited for violating these new hours, and when it was taken to the courts, they actually found in favor of the new bill. So the city actually had the footing to uphold these bills and stuck with it, which is very important. And on that note, I would like to implore community coalitions as well as key stakeholders who are interested in these alcohol-related issues and making their neighborhoods safer for everyone to actually advocate for changes in operating hours based on this evidence. I don't think it'll come as a surprise to anyone that California is constantly doing things against this, but with all of us together, maybe we can push them through. And I would like to thank my co-authors, especially my mentor, Dr. Pamela Trangenstein, and David Jernigan, who I'm sure many of you are familiar with. And we will have time for questions. I think we have a good amount of time for questions, actually. But if you have any questions that you think of later after you've digested the millions of results I've thrown at you, you can also email me here. And that was all I have for you.